take the situation seriously. If you know of a teen whose behaviors have changed and look like all that we've been discussing, please let the parents know that there's help available and encourage the family to seek help from a professional. Suicidal thoughts are common in depressed teens, and some studies suggest that 50,000 teens attempt suicide each year, and as many as 5,000 are successful. That would be 10%. Other studies suggest that the number is 15% of depressed teens ending their life through suicide. By the way, another study notes that of all the teens that commit suicide each year, only 7% were receiving mental health treatment at the time of their death. 93% were not receiving any kind of treatment for depression when they committed suicide. Poor self-esteem is common with teenagers, but especially with those who are depressed. And there's often an increase in self-destructive behaviors such as alcohol abuse, drug abuse, sexual promiscuity. Parents are often confused and frustrated when their teens begin to act like this. And sometimes parents become stern disciplinarians or even put the teen down, which only serves to increase these feelings of guilt and depression. Other times parents feel helpless and stand by waiting for adulthood to arrive. Of course, neither of these is the right option to take. And even with only a small percentage of teens with ADHD or depression receiving treatment, use of ADHD medicines prescribed to girls in the study that just was published recently, it was up by nearly 75%, and the use of antidepressant medication was up by nearly 10% in girls between the years of 2001 and 2006. To add to this drama, you've no doubt seen the recent news headlines about a federal panel that recommended to the FDA that antidepressant medications carry the strongest possible warning label for use in children and teenagers. Also, a panel recommended strongest possible label for ADHD medication. This recommendation to the FDA shook the treatment community, those who worked with depressed young people. And now the FDA mandates that antidepressants as well as ADHD medications used to treat adolescents and children carry that dreaded black box warning label. What the media did not report well is the fact that 10 to 15% of children and teens with depression who receive no treatment will commit suicide. These 10 to 15% will not just think about it, they'll actually kill themselves. So what are we going to do? If the media had their way, it seems that no teen with depression or ADHD would ever receive treatment. As a result, the suicide rate for those who could be using antidepressant medication would rise from nearly 0% to about 15%, which is the suicide rate for depressed teens who are untreated. And yes, while there are actually young people and adults who have become suicidal only after beginning treatment with an antidepressant, remember that they were likely suffering from depression already, or else they wouldn't have been being treated with antidepressants. And it is sadly true that some have in fact gone on to take their own lives after beginning antidepressant medications, which is absolutely tragic and heartbreaking. But so is the fact that untreated depression is very risky and potentially fatal. As many as 15 out of 100 young people with depression will take their own lives unless they receive treatment. These young people should be allowed to receive a treatment that will lower the suicide rate dramatically and without any stigma attached to it by the media. With proper diagnosis and treatment, a depressed teen or adult can be greatly helped. If someone close to you is suffering from depression, first, please understand that depression is a very emotionally painful condition. Please take the situation seriously. If you know of a teen whose behaviors have changed and look like all that we've been discussing, please let the parents know that there's help available and encourage the family to